everybody, my name is Carol Mack. This tutorial will discuss the Notice of Privacy Practices. The poster is hanging on the wall, but do you know what's in it? The NPP regulation resides in Privacy Rule Subpart E. The Privacy Rule establishes the right of an individual to receive adequate notice of an entity's privacy practices. NPP templates can be purchased or copied from many different sources, but the NPP should be tailored to fit the covered entity. The Privacy Rule requires 8 elements of content. The first element is a header with specific language. The second element is a list of uses and disclosures of PHI. The NPP must contain at least one example of treatment, payment, and healthcare operations. That's TPO for short. It must describe kinds of disclosures that require signed authorizations, such as psychotherapy notes. It must say that authorization is required for the sale of PHI, and it must say that authorization is required for marketing. The NPP must include separate statements for certain kinds of activities. If the entity intends to use PHI to raise funds, the NPP must inform patients of their right to opt out of fundraising solicitations. The NPP must include certain statements about individual rights. It must say that the individual has a right to request restrictions, including a statement that the entity must agree to restrict PHI if the patient pays the provider in full. It must say the individual has a right to request confidential communications, and it must explain the right to copy and inspect patient records. The NPP must say that the patient has a right to request amendments to PHI, and a right to receive an accounting of disclosures, and a right to receive a paper copy of the NPP. The NPP must include certain statements about the covered entity's duties, such as breach notification. The NPP must provide instructions on how a patient may make complaints. It must have a statement that assures there will be no retaliation. The NPP must provide the title, address, and phone number of the contact person, and it must show the effective date. The Privacy Rule requires entities to distribute NPPs to patients when there is a direct treatment relationship. The provider must provide NPPs to all new patients and make a good faith effort to obtain the patient's written acknowledgement of receipt. The provider must post the NPP in a clear and prominent location and make hard copies of the NPP available on request. Now we'll see how an NPP is revised in the town of Single Peak, where Priscilla and her husband Hudson have been practicing medicine for many years. In 2003, Pete became the privacy officer. As the practice grew and grew and grew, Pete's management job got more complicated. He started whining and complaining, and he threatened to walk out. He told Hudson that someone else should update the Notice of Privacy Practices.
Priscilla, are you going to finish updating the NPP? We already missed the compliance deadline.
But aren't you the new privacy officer?
Yes, but you agreed to be the contact person, so the NPP is your responsibility.
All right, but I think I'll get some help from our attorney.
Hi Priscilla, let's take a look at the current Notice of Privacy Practices.
We've been using this one since 2003.
First, we'll update the section on authorizations. The NPP must say that authorizations are required for psychotherapy notes, sale of PHI, and marketing. It must also say other uses and disclosures not described in the notice will be made only with the individual's written authorization.
Do we have to worry about the new definition for marketing? We're using PHI for direct mail advertising. We want all of our patients to know that Dr. Kramer has joined our practice and he gives chiropractic care to people of all ages.
The new high-tech regulations clarified the definition of marketing. You don't need authorizations to advertise your services. Authorizations are only required if the advertising involves financial remuneration or payments for promoting a third party's service.
I see. Dr. Kramer is not a third party, but I wonder if the coffee house is a third party.
Are you promoting the coffee house?
Yes, we have discount coupons for the coffee house in our waiting room.
A gift of nominal value isn't marketing.
Can we also help the coffee house sponsor the bike fiesta for children's health?
You mean the Chamber of Commerce fundraiser?
Yes, I'm on the hospital fundraising committee. And our office is soliciting sponsors for Dr. Kramer's bicycle team.
Yes, if your NPP includes a statement on fundraising. Certain categories of PHI can be used for targeting donors. But the NPP must include a statement about the patient's right to opt out of receiving such communications.
Can we send email messages to our patients?
Perfect.
Yes, if the email isn't subsidized by a third party. You can also send email communications like appointment reminders. Such communications are for healthcare operations.
What about breach notifications?
Yes, you need to add a sentence to explain breach notification. You also need a sentence about restrictions. The provider must honor such requests if the patient pays out of pocket in full.
And how should we distribute the updated NPP?
You hang a new poster on the wall and make hard copies available to patients. You could buy an updated HIPAA poster from the web, but I would be happy to customize one for your office.
Thanks, Anne. I'll discuss it with Hudson and get back to you on Monday.
If you decide to use pre-printed posters and brochures, make sure it follows California law and doesn't conflict with your office practices. Thanks for joining me in this tutorial. Now I want you to meet my colleagues, Roman Diaz, President of Touchtone Compliance, and Karen Darnall of Darnall Law Office.
We made these tutorials to help you learn about HIPAA and California law. For individual attention, go to our contact page. You can send us a message or schedule a consultation.
And I'm Roman Diaz, President of Touchtone Compliance. Our online tools and expert services provide everything you need to successfully address HIPAA compliance. We identify vulnerabilities, provide a thorough risk analysis, and assist with mitigation plans, policies and procedures, and staff training.